Are we live?
Doctors, we are live. You can start the session.
Hi, good evening, everyone. Welcome to the Young Ophthalmology Zen webinar. So basically, Zen is a subcommittee which we have formed recently, which looks at the mental health and well-being, as well as looking at the social activities of young ophthalmologists. So today, this is our first webinar. So we will be talking about the burnout among the medical residents. How do we recognize it and how to overcome it? For this, we have an expert panels and speakers joining us. We have Dr. Ankita, we have Dr. Jagjot, and Dr. Devanshu. Apart from that, with the efforts of Dr. Divakant and Dr. Nilesh, we have been able to collaborate with Thriving Minds. Dr. Sonal Kalia, she has also joined us in this webinar, and we'll be discussing about all the health medical issues or the mental health problems which the residents face, and then we can further discuss how Thriving Minds can bring a change, uh, and how young ophthalmologists can take help of Thriving Minds for a better mental health. I think my slides are not working. Just a minute. Are the slides moving, Mosmi?
No, sir. Sir, yeah, it's moving. It's moving.
Okay, so Dr. Divakant, he is the president of Young Ophthalmology Society of India, and it is with his efforts that we came up with this idea of Zen committee. So he's the director at Swanjyoti Eye Hospital. Unluckily, he's not able to join us, but we have Dr. Nilesh as well as Dr. Sonal Kalia, who have played an instrumental role in formation of the Young Ophthalmology Society at the. So whatever we have achieved today. So Dr. Nilesh is here with us. He'll be telling us about how we basically collaborated with Thriving Minds. It is his idea. He came up with Thriving Minds. And Dr. Nilesh, are you there?
Yeah, thank you, Dr. Ashish. First of all, I would like to thank Dr. Sonal ma'am. Sonal, it was Sonal ma'am's idea basically to start these presidential working group during her tenure. That was the first time Yosi had those, and ma'am was very keen on having extracurricular things also along with the academic PWGs. So, ma'am, last year also we took some some mental health issues and some other stress busters in socio-cultural initiatives. So when Dr. Divakan Mishra took over, then we thought that we will expand it and make it a separate thing because it is very important. I think the term was your idea. I think the term was given by you, Dr. Ashish. So then by chance I met Dr. Devanshu sir. He has been my senior at diploma in JNMC, and I had lost touch with him, and luckily I got in touch with him during AIOC Dehradun, and then he told that he has pivoted from being an ophthalmologist to being an entrepreneur, and he has started this Thriving Minds in collaboration with Dr. Ankita. And this was a perfect opportunity that I took, and I asked him that it will be great if he can be on board. So that's how Thriving Mind came on board. They are doing a great job. They are providing expert service to all the medicos and beyond also. So we will love to hear him say what he is doing and how he will help young ophthalmologists. And thank you again for inviting me, and keep doing the good job. I'm looking forward to more initiatives from you, sir.
Thank you, Dr. Nilesh. Dr. Sonal Kalia, she is the one who has always encouraged me, always on messages and telling me what more we can do in Zen committee. She had been an immediate past president with Yosi. She is also an executive member of Jaipur Ophthalmology Society, executive member of Rajasthan Ophthalmology Society, and has numerous awards and academic laurels to her name. Ma'am, your viewpoints on starting this Zen committee?
I'm thankful to you, Ashish, for the kind introduction. and it was very good initiative. The name Zen also is such a I should say the name that really brings you close to the idea of keeping your mental health as a priority. And I'm grateful to Nilesh and Devakant for taking the presidential working groups forward and making not just the socio-cultural but the mental health initiative also as a full separate team. And with Ashish's collaboration with Dr. Devanshu sir and Dr. Ankita ma'am, it will be, I think, quite a good supportive network for the residents and for other ophthalmology trainees also. Not to say that the stress is less at the senior level, the stress I think goes on increasing, but maybe you start learning to cope more. And so all those strategies will probably be highlighted today by the stalwart speakers that we have. So thank you, Ashish, and wishing the entire team all the best for this venture.
Thank you, ma'am. Dr. Moshmi, can you introduce our expert panels as well as the speakers for the day?
Yeah, sure, sir. Thank you so much. So I'm elated to introduce Dr. Devanshu Arora. Dr. Devanshu Arora, sir, is an accomplished ophthalmologist and healthcare management professional. He holds an international MBA from IE University, Spain. He is currently serving as the general manager of Nivora Eye Institute in Dehradun. His vision includes development of a comprehensive network of eye care facilities across Uttarakhand, aimed at delivering high quality and affordable eye care services. He is also the co-founder and business head of Thriving Minds, which is a growing mental health organization providing holistic mental health services. In addition to his management role, Dr. Arora is actively involved in delivering talks on practice development, sharing his insights on enhancing clinical practices, optimizing patient care, and implementing effective management strategies in single specialty healthcare centers. So, welcome, Dr. Devanshu, sir, and a few words from you before we go ahead.
Sure. Thank you so much for the wonderful introduction, and thank you, the team of Yosi, for having this collaboration with Thriving Minds. So, in fact, Nilesh met me in the midterm AIOC conference at Dehradun, and when I told him about the different ventures I'm doing, and one of them being Thriving Minds, where I'm actively involved in the management, so he was very excited, and he said that we are coming up with this Zen initiative, and it was in fact a wonderful coincidence to have that opportunity to collaborate. And we are looking forward to have an active discussion around mental health topics which are relevant to ophthalmologists and especially for young ophthalmologists. And with that, we have a very relevant topic at the first beginning of the series of the webinars, where we'll be talking today about burnout, and Dr. Ankita, who is the clinical lead of Thriving Minds and leading psychiatrist, will be talking about it. So at Thriving Minds, I'll just briefly mention we are basically providing holistic mental health services under one service, and our services are available both online as well as offline. And we'll talk more about it, how you can avail, how members of Yosi can avail the services of Thriving Minds as and when required. Right. So thank you so much for having me, and over to you, Ashish.
Thank you, Dr. Devanshu. So our next expert panel is Dr. Jagjot. Dr. Moshmi, can you introduce him?
Yeah. So welcome, Dr. Jagjot Singh, sir. Sir is a consultant psychiatrist with an experience of 8 years in the field of psychiatry. He did his MBBS from GMC Patiala and MD Psychiatry from DMC Ludhiana. He is currently working as a principal consultant in the Department of Mental Health and Behavioral Sciences, Fortis Hospital, Ludhiana. He is also a founding director of JJ Clinics. He has done various national and international presentations. Few topics of interest of his are economic burden of depression, effect of demonetization on mental health, adult ADHD, and metabolic syndrome in psychiatry. He is also certified in medical psychiatry from Harvard Medical School, Boston. He is also certified in recent advances and treatment in Lewy body dementias from Mayo Clinic, Rochester. So welcome, Dr. Jagjot Singh, sir. Would you love to give some insights regarding today's webinar?
Thank you. Thank you so much. I think it's a very relevant topic. One, especially for the younger audience, needless to say that the adult and the elderly are not immune to it. I was very happy when Ashish told me that this is the topic that is being discussed, and his intentions are, to have a wide era and a wide area or approach, including the residents and the younger lot, which do not have the coping skills at that time. If at the right time they can have the help and the guidance how to deal with stress and how to manage the tough times, I think they'll really benefit from this topic and such meetings. So looking forward to it. I think primarily it will be done by Dr. Ankita. I'll be just adding on to bits and pieces if required.
Thank you, Dr. Jagjot.
Thank you.
And finally, our speaker, Maushmi, please introduce.
Yes, sir. So finally, our speaker, Dr. Ankita Priyadarshini ma'am. So I'm elated to introduce her. Sir,
Sorry.
the slides, please. Yeah. So, ma'am is a psychiatrist with special interest in de-addiction, child and adolescent psychiatry, and she is the founder of mental health organization known as the Thriving Minds and Mental Health Center and various platform providing psychiatric treatment and therapy globally. She has special interest in the area of neuromodulation, de-addiction and rehabilitation, child and adolescent psychiatry, women's mental health, sexuology, and neuropsychiatry. Ma'am has she has done her MBBS from Jawaharlal Nehru Medical College, Belgaum, Karnataka, and she is a distinction holder in many subjects. She has also won the best paper presentation at CANSIPS, and she has many academic laurels to her name, but few of them to mention: recipient of Global Women Inspiration Award 2022, recipient of Exceptional Women of Excellence Award by Women Economic Forum. She is a recipient of Most Promising Psychiatrist and Mental Health Advance 2024 by the Success Today magazine, among many others. So welcome, ma'am, and we are looking forward to hear your talk today.
Thank you so much, everyone, for giving me this opportunity, and I'm elated to collaborate with the young ophthalmologists here. And it indeed is a very, very important topic that we must foster and we must propagate, not just keep it to ourselves, but also propagate in the whole community. And thank you, Dr. Ashish Martin, first of all, and Dr. Nilesh for approaching us for this wonderful collaboration. So, if you permit, I might begin with my slides.
Yes, ma'am. Yes, ma'am. We're actually very delighted to have you on board and listen to you. It would definitely be very helpful for all the young ophthalmologists out there. So I'll just stop sharing my screen so that you can start with your presentation.
Sure. Is it visible to everyone?
Yes, Dr. Ankita, it is visible.
So today's topic that we'll be dealing with is burnout, recognizing and overcoming. So it's a Yosen initiative, and I, Dr. Ankita Priyadarshini, I will be dealing with this topic in as much detail as possible. Of course, keeping the time frame in mind. So, what is burnout? Basically, it's a state of emotional, physical, and mental exhaustion that usually happens from the prolonged state of workload pressure that we go ahead with, and along with that, usually it is mainly what we call as a stress. Apologies for that, my slide is not moving. It's getting stuck. Can you see it now? So it is often related to work or other demanding situations. And burnout is usually characterized by feelings of overwhelming fatigue, cynicism, detachment, and a sense of being unproductive or ineffective. So if you talk about the key statistics here, I specifically took out the data from the recent Mayo Clinic, which said that burnout affects nearly 50% of the surgeons globally. Ophthalmologists face unique stressors like precision-driven surgeries and the patient demands. If I give you a real-life context, usually an ophthalmologist struggling to focus during back-to-back cataract surgeries, because it's usually burdened with you have huge load of OPDs going on, and simultaneously you have to start with the operative procedures as well. So now there are certain stages of burnout. Precisely, there are 12 stages, but I have clubbed them into 5 stages. The first one being the honeymoon phase. Now remember the day once you first enter a new center, or it's your first day at work. Everyone is very enthusiastic about it, high energy, a strong sense of purpose is there. You are driven. And usually these individuals are excited about their work and other activities, and they feel motivated to take on the challenge. Now, the second stage comes, that is the onset of stress. Everything is fine in the honeymoon phase. Once the stress happens, that usually presides the demands and the pressure of work or other activities that you may feel that it is becoming very overwhelming for you, and you start experiencing stress. Common symptoms that you feel are feelings of frustration, irritability would be there, and trouble sleeping. Most of the time, sleep disturbance is the first thing that strikes you that, okay, there is some stressful event going on at work. Third one is the third stage that comes is the chronic stress. As the same stress persists, you will feel that the physical symptoms start cropping in, such as headache, gastrointestinal problems will come, such as emotional symptoms like anxiety, and if it proceeds further, depression might step in. They may begin to feel withdrawn from the social activities, and you will also have difficulty concentrating at work. Usually that's the stage where people tend to express that, okay, things are not working out well for me, things are not going smooth for me. Then the stage comes which is of the burnout, the fourth stage. At this stage, usually tend to feel a sense of emotional exhaustion. There's certain amount of detachment from their work or other activities. They may always feel cynical, disillusioned by the fact that you can do it more, but the body as well as your emotional levels are not allowing you to do that. Plus, there will be a reduced sense of accomplishment. Whatever you have achieved so far, everything is going to feel that, okay, you can keep all this at a back burner. Nothing is good enough for me at this point of time. They may also experience physical symptoms such as chronic fatigue and insomnia. Whatever the stress was there previously, it started with sleep disturbances. Now it goes ahead into the form of chronic insomnia. The last stage is habitual burnout. We might have faced our seniors and super seniors. They may say that, okay, ye to hota rehta hai. This is just a part, this is just a phase. You will come out and then again you will go in. Precisely, they are suffering from habitual burnout. They have become so much used to it that it has become a part of their normal day-to-day activity. So what happens in the final stage? It becomes so chronic that it leads to significant physical and mental health problems. Like they may feel hopeless, helpless. Sometimes even the biggest of achievements will give them very minor amount of happiness. You'll always see a constant, dull face, and you will not see any form of happiness on them. They will always be very cynical, always be very critical, and sometimes they even have difficulty functioning in their normal day-to-day activities. Forgetfulness is one of them. They may experience severe physical symptoms like chronic pains, illness, and sometimes even require psychological interventions. So now what makes you vulnerable as an ophthalmologist? You might ask, right, why we per se are vulnerable to the stress. We understand that physicians are, but what makes ophthalmologists vulnerable? First one, prolonged focus requirements. Your microsurgeries, such as your cataract or retinal surgeries, they require precision, they require constant focus. Now, spending 2 to 3 hours over a complex retinal detachment surgeries, you will definitely bound to feel mentally exhausted at the end of the day. So that's one problem here. Secondly, repetitive procedures with high stakes, like procedures like LASIK or phacoemulsification. They create monotony. Now you pair that with constant pressure for perfection. I'll give you an example. A LASIK patient dissatisfied with minor post-op blurriness, despite excellent result, causes the surgeon undue distress. You have tried your best, you have explained to the patient, but still you are not able to give the optimal result as per his expectations. So definitely that is bound to create some amount of stress. Now, third is patient expectations and demands. Now, patient often expect perfect outcomes, even for age-related conditions like, in your case, presbyopia or glaucoma. Now, dealing with these patients who demand 100% recovery from any age-related problems like that of macular degeneration, or, despite of being informed, that also leads to lot stress and burnout sometimes if you do it on a repetitive basis. Now, high volume of patients in your case, yes, managing a busy OPD with, while addressing pre-operative and post-operative cases and cares for these surgical patients, like you people, you attend almost 40 patients in an OPD on a regular basis. Now, during that time, you are rushing to complete 3 cataract surgeries without any break. So definitely these high-end surgeries plus the dreaded demands of the OPD, sometimes it causes a little bit of mismatch. That management often leads to the high amount of stress that you have to endure. Then there are complications in the in normal routine surgeries as well, like even minor complications in common procedures like cataract surgery. That can also lead to a heightened sense of doubt in you, like an unexpected, we call it, what do you call, posterior capsular tear. So that during a cataract surgery often leads to some amount of questioning your techniques. You tend to think about it, you tend to dwell about it. And if that happens in 1 or 2 or 3 patients consecutively, imagine the amount of stress that you are going to have. So now then comes lack of breaks or personal time. It's inevitable that long shifts are there. You will have to, you have packed up schedules with often no breaks or time for proper meals. Now imagine skipping lunch to complete back-to-back patient procedures, patient consultations, and surgeries. So definitely it is going to add on to the stress factor. Then administrative and medico-legal burden. Needless to say, we have to document. Documentations are long, especially for private practices. Even in medical colleges, documentations, history taking, and everything is quite elaborate. But we have to be safe. We have to safeguard ourselves. So documentation, maintaining patient records, and the fear of legal repercussions, that further increases the stress. The last one, but not the least one, is the technological overload. Now, as the digital era is exploring itself, now continuous use of these digital tools, such as your slit lamps or OCT, those EMR systems, there are a lot of digital strain to your eyes, and that also contribute to a significant amount of stress. Now, we often use stress as burnout and burnout as stress. They are often, used together. So are the two same or are they different? So now if you talk about stress, it usually involves over engagement. Like you want to give it out to the best of your levels. They say that some amount of stress is important if you want to feel your desire, if you want to feel driven. So some you try to over engage there, you give in your best. You are reactive or overreactive emotions. Like, sometimes you might feel that you have to operate 10 cases, but suddenly 10 more cases are coming forward. You tend to become very jittery. You become very snappy at that point of time. You are a little anxious that, okay, let's get it done as soon as possible. So reactions are natural here. Then there is sense of urgency and hyperactivity. You will definitely want to put across as much as possible. Then there will be lost or diminished energy. Sometimes because you are putting in too much, you will definitely be exhausted, and which is why, because of hyperactivity and urgency, it leads to anxiety. So this is your normal stress. Now, if I talk about the example here, it is handling a full day of LASIK surgeries with minor fatigue. So if you can imagine, that's your normal stressful day out here. Now, if you talk about burnout, burnout means disengagement. You do not feel like engaging in or doing that what you usually used to love before. Now you have blunted or distant emotions. You're not able to connect whether you really want to go ahead with it, whether how you're feeling from inside. You don't feel the same person how you were before once you started doing this job. Thirdly, there will be sense of helplessness, right? You don't know whom to ask for help, whom to reach out for, and motivation is significantly lost. And it usually leads to feeling of depression. There is no doubt about it that burnout is one phase where the emotional toiling is so much that the person is not able to express himself or herself. They suffer from inside because they don't even know how to connect with the other person. Example is dreading performing another cataract surgery despite years of expertise. You know you are the best, but still you are not able to do so. And usually they are the ones who, in some cases, even give up practicing altogether because they feel that they don't have it in themselves. So now there are certain common burnout symptoms, which I'll enumerate that will help you in understanding it. First one is exhaustion. Exhaustion could be feeling physically and emotionally drained, lacking in energy, feeling tired all the time. Then there is reduced performance, but natural. It is difficulty in concentrating, reduced productivity at work. Your motivation is completely down. Cynicism and detachment, which is a feeling of detachment from work and colleagues, and a sense of negativity that usually is towards your work environment. Then we have emotional distress, that is feeling anxious, irritable, or sad, and even experiencing mood swings. They are also very common. People don't talk about mood swings here, but usually, if you have any colleague who's suffering from this problem, you will find them having a lot of mood swings there. Then comes the physical symptoms, which are like headaches. You'll often find them complaining of some muscle aches and pains. Stomach problems, gastric issues are also very common. Then insomnia, difficulty sleeping or staying asleep or waking up feeling unfresh. Despite of having good 6-7 hours of sleep, they don't feel fresh. Loss of satisfaction, like feeling like your work is not fulfilling and losing satisfaction or enjoyment from the work that you used to enjoy. As I said, you will not be able to identify with the person once you join. You remember the honeymoon phase. It is completely the stark opposite of how you have joined them. Increased absenteeism, sometimes taking more sick days or time off work than usual, and you will find them they always have some of the other excuses to avoid doing that work. Then neglecting personal needs, that's also very important here, such as your exercise, your hobbies, and socializing, and focusing only and only at work. So you can remember this chart. These are certain subtle signs what you feel during burnout, like your headache, muscle tension, neglecting your self-care, all the negativity that is surrounding your workplace, isolation, keeping yourself distant, not engaging any social activity, feeling helpless and drained, endless anxiety and feeling overwhelmed, sometimes overly tired and constantly yawning. You'll find them constantly yawning in your seminars or in your classrooms. Then feeling numb or even apathetic about life. Literally, they feel that there's nothing good about life which is existing. This was the data. This is the recent statistics which I have found out. So overall burnout rate came out to be 37% of the 592 ophthalmologists which were taken for study. Again, this was a data from Cleveland. So they found out that burnout by subspecialty, they also were able to find out, which was 30.8% for vitreoretinal specialists, which was the lowest, and 45.4% for the uveitis specialist, which was the highest one. Majority of them by severity, they had 65.2% had mild severity, while 29.5% moderate, followed by only 5% who had severe. Now, the burnout risk came out to be more in female ophthalmologists, which was 46.2%, than of male, precisely 31.2% of male ophthalmologists. But women were 1.9 times more likely to report burnout. They were more vocal about it. Now, the practice type was usually those who were involved more in academic setting were 2 times more likely to report burnout than those in large private groups. And physicians usually employed in hospital settings were 2.4 times more likely to report burnout than those in large private groups. Now, usually these burnout was associated with low work control, insufficient time for documentation, and misalignment with the departmental leaders. Again, the hierarchical structure. Though it is foreign data, but I think we can relate because almost a similar sort of settings and incidents have been found even in India. Now, 1 in 4 doctors reported feeling depressed, which was the highest percentage in the last 5 years. And specifically, post-COVID, this data has been continuously increasing. We are still awaiting the newer data. Now, do doctors seek professional help for burnout or depression? So this was the data which got published. So it said that 13% of the doctors have, only 13% of the doctors have sought out professional help. Other 47% doctors have not sought help but would consider it, but a great amount, which is 39% doctors, who have not sought help and would never even consider asking for help. This was a strange data which I found. So if we talk about certain prevention strategies related to it, so time management. is very important that we manage our time. We talk about time management, but nobody does that. Often we found ourselves getting stuck and again setting ourselves in the same loop. So it is very important that we allocate some focus slots for surgeries, consultations, as well as some administrative work. Because unnecessarily overloading yourself by not prioritizing your task will eventually lead to some amount of burnout. For example, Dr. Devanshu gave me this beautiful example, because when he was at Arvind Eye Institute, he said that they would reserve mornings for very high precision cataract surgeries, because they knew as the day would proceed, there will be a lot of OPD burden which will be coming forth. And this actually works well if you want to combat your stress and if you don't want to juggle two things together. So definitely you can reserve your morning hours for some high precision tasks like your surgeries, and when concentration is at its optimum. So they are actually utilizing the concentration aspect here, and definitely that's one of the reasons why they are able to perform optimally. And afternoons, especially for OPDs and follow-up patients, and even for the counseling part, you can use software, scheduling software, and then that would obviously help you minimize your time here. Second is delegation. We doctors, we often find ourselves doing everything, whether it is documentation, whether it is the vision testing, whether it is, the explaining the complications, explaining the procedure, everything we want to do it ourselves, because we feel that, okay, this is how the perfection is going to come. But obviously it burns us a lot. It literally emotionally drains us to an extent that would further deteriorate our productivity. So delegation is very, very important. We have to train and trust our team member who you can handle these routine tasks, and which further allows us the space to focus on the critical cases. So especially delegating these non-critical activities like preoperative counseling, consent forms, or initial vision tests becomes very easier for the other people, and that saves us a lot of time. So like assigning your technicians to handle these preliminary assessments, or freeing your focus so that you can actually plan your surgery better. Now, self-care practices. We talk about self-care practices, but hardly we end up doing it, especially regular exercises, which basically counteracts the effects of prolonged sitting during surgeries. Adequate sleep, proper nutrition to maintain our stamina and focus. Now, I don't remember when was the last time during your continuous OPD hours, you just take 10 minutes out and do a little bit of stretching. Hardly anyone does that. Little bit of stretching just before your routine surgeries, or even, that would reduce your stiffness, and that will help you in, sitting for longer hours. And also because you have to keep a posture, same posture attained for a pretty long time. So all these things will basically ease you out to function better. Then I don't know, there are a lot of clinicians who usually keep on doing surgeries on and on and on and forget to hydrate themselves. It's just basic thing. Please hydrate yourself in between. You can keep your water bottle, you can keep little bit snack, and keep yourself hydrated and energized. That further builds up your practice, that further builds up your concentration to perform better. Setting boundaries. We as doctors, we often feel guilty that, okay, every time is for the patient. We have to give maximum to our patient, not realizing that it is costing us. So limit after hours patient communication unless it is an emergency. Define work-life balance by dedicating time to even your personal interest. Like, sometimes patients do tend to call. There are certain non-urgent calls which can be addressed during OPD hours as well. Rather to, because unless and until you demarcate these boundaries, definitely there will be constant interruptions in your own personal time. So that needs to be done. Now, incorporating breaks, that's also very, very important. I don't know why we are so harsh on ourselves, and we think that, okay, breaks are something we are not meant for. Jabki it builds up our productivity. We feel guilty once we are taking break, because we feel that it's happening at the cost of our patients. But believe me, patients will wait and they will come to you. So there are 3 breaks which I have categorized into. First is micro breaks, which is 2 to 5 minutes. You can have short breaks between surgeries to decompress and reset your focus. I'll give you an example. Activities like just close your eyes or gaze at a distance. You can step outside, look outside a window, or even, just for the change of scenery. You can do a little bit of neck stretches so that relaxes you, decompresses the strain. Second one is your structured breaks. You can schedule a dedicated time for meals or snacks between surgeries and OPD sessions. Avoid skipping your breaks as they maintain energy and focus. For example, you can block 15 to 20 minutes for a coffee break or, after completing a batch of surgeries and before starting your OPD. The third one is the longer breaks for recovery. You must plan vacation. Plan vacation days or even extended weekends to prevent these prolonged period of stress. Like take a break or two after a week of heavy surgical overload. Engage with your family, relax with them, enjoy your hobbies, enjoy your family time, most importantly. Then there are certain recovery strategies. This usually is once you already feel that the burnout has hit its peak. So start with peer support group first. Join some peer discussion groups to share your challenges and gain insights from colleagues. I am pretty sure every institute has some or the other peer group support. Either if it's in a medical college, yes, definitely counselors are there. They usually support these students. Usually mentors are provided to them. So definitely you can discuss it out, express it out to them how you are feeling. Unless and until you express them out, how will they come to know whether some problem is already going on at your end? So discussing certain difficult cases also sometimes lead to a lot of insights that usually you can get from your fellow ophthalmologists, how they have combat those difficult cases, how they have combat those challenges. And if that a work related issue is leading to your burnout, then definitely it can be adjusted and it can be addressed in just a peer group setup. Then professional counseling. Consult a mental health professional if burnout symptoms persist or worsen. Usually, for example, you can seek out therapy, you can address your feelings or inadequacies, or sometimes even a rare complication that you might have had. And that sometimes lead to a lot of stress. Sometimes people are not able to forgive themselves for a mistake that they have done. And it keeps on cropping in the back of their mind whenever they are operating, whenever they are dealing with the next case. So those things, those challenges need to be addressed. It can be with your anyone. It can be with your therapist, your counselors there at your professional setup. And sometimes even discussing it out with your friend also gives a little bit of bust. And definitely, if it is not getting sorted out, do consult a therapist. That would be definitely working well for you. Reframe challenges, most important. Shift focus from mistakes to learning opportunity. It is very easily said than done. Usually we dwell over our mistakes repeatedly, and whenever we see the same case, the backflashes and all the flashbacks come to our mind. So we have to learn. We have to make ourselves resilient enough to shift our focus from our mistakes to that of thinking it as a learning opportunities. For example, instead of dwelling on a patient who complained once, use it as a feedback to improve your counseling and manage better expectations for them. Then develop hobbies or relaxation exercises. It's very simple, but least done. You can engage in activities which is unrelated to our work to disconnect and recharge. But on the other side, what we do, we just keep on discussing. Even when we are there away from our workplace, we keep on discussing the same cases, same situations, same scenario. We feel that, okay, we like that, okay, other person is also sailing in the same boat. We try to feel happy about that, not understanding that you are just building up that stress what other person is already going through. So please engage in activities which are completely unrelated to your work. Practice your hobbies. Most importantly, slow down when needed. Avoid overloading your schedule with back-to-back cases and with which further that leads to a lot of mental and physical exhaustion. Like you can limit your daily number of surgeries. Definitely it varies from person to person, the capacity to capacity what you might be having. But I think at the end of the day, everyone knows how much I am able to operate upon, how much I am able to give my best into. So you can have those numbers, and so that you are able to focus and give your best output and maintain the quality. At the end of the day, quality is everything. This is just a chart so that you can remember what all you have to foster: your hobbies, your quality time with your loved ones, take regular breaks, exercise, and self-care most importantly. So we are coming to the key takeaway points here. Burnout is common, but it is manageable. It's important that we recognize early signs like emotional exhaustion and detachment to prevent any long-term consequences. Secondly, prevention is always better than cure. Learn to prioritize your tasks, delegate effectively, and practice self-care to reduce the stress. Thirdly, breaks boost performance. So incorporate micro breaks, which we often tend to forget during surgeries, and structure breaks between work sessions. Seek support and reframe challenges, like engage with peers, seek professional counseling, view setbacks as opportunities to learn. And most importantly, balance is key to success. Set boundaries between work and personal life so that we can have sustained productivity and well-being. Your mental health is equally important, rather more important than your work. And if you want to move ahead, if you want to grow ahead, then it is important that you first prioritize your mental health. Work shall follow. So if there are any doubts, I'll be happy to take.
Thank you, Dr. Ankita. Thank you so much. That was a very detailed and insightful presentation on all the mental health issues, specifically what young ophthalmologists or ophthalmology in training will face or they actually face. Also, you brought about various important points like what is difference between stress versus burnout. We never knew that stress is different and burnout is different. You talked about various preventive strategies, also the recovery strategies. I really like the point where you talked about different types of breaks which can be taken, like the mini breaks. Even 2 to 3 minutes of a break between work can make a difference. So I think all of these points, these are takeaway points which which should be considered by all of us, all the young ophthalmologists, all the residents. I don't say just the ophthalmologist, every resident in training, because we know that training is a difficult period for all of us. I just have one question from you, ma'am. That that how can a resident actually recognize that their stress levels have reached to a particular level that they require a professional help? And if they require a professional help, should they approach a psychiatrist first or a psychologist?
As I said, it's never suddenly a person comes out with a burnout. Usually there are stages, like I described about the 5 stages in stress, right? There comes a stage where they feel that they are not enjoying their work at all. They feel that they don't want to go ahead. They don't want to attend the classes. They don't want to attend the rounds. They don't want to go to the OT and see how the cases are being performed. Everything starts giving them anxiety. They start feeling panicky about every other situation. Plus, you will find them lot of irritability is there, jitteriness is there, sleep disturbances, as I said, they are very, very common. In fact, their eating habits are also deranged. Mood fluctuations are very common. In fact, before they come to know themselves that I have a problem, usually their colleagues start pointing them out that, okay, you are not working optimally. There is some problem which is happening with you. Please consult or please talk to somebody. So during this time, the intensity or the severity is so that ideally we usually suggest that you first talk to your seniors there. You let them know that something is not right with you, whether it is your mentor who has been assigned or whether it is your in the hierarchy system. If you have your consultants who are being please inform them, keep them in the loop that you are suffering from this problem. Then second comes, depending upon your feasibility, I personally suggest that you go to a therapist first. You talk to a psychologist, a counselor first about your problems. Sometimes it so happens just by discussing your problems out, you get some or the other clarity. See, counselor will not be able to tell you how to maneuver your problems in your OT or in your professional setting, but definitely they will give you certain quick tips how to balance your life, what is to be done at the initial level so that you can combat it so that it doesn't progress to a level where you require medications, because usually psychiatrists come into picture when medications are required, which is usually when the person has started suffering from depression, anxiety, or chronic insomnia. So my suggestion, definitely go to a therapist first, discuss your problems out, understand where the things are not going right for you, understand what can be done at a very initial and nascent phase so that you can prevent the chronic burnout phase.
Dr. Jagjot, you want to add something to the same thing?
I think it's very rightly said. You have to understand that the main of milder mental health issues is dealt by psychologists. Conditions such as stress, burnout, these are issues. These are not illness disorders. They can be dealt by psychologists. Second concept I would like to introduce, which is widely known as of resilience and vulnerability. There are people who are very resilient. They rarely face burnout. If at all, they take a break and they feel refreshed. Our role comes into the picture when there is a vulnerable section. Let's say there's a family history of depression. Let's say I know that my resilience is not too much, like an elastic. You can imagine an elastic band as an elastic. And one of us is not resilient. Now he have or she.
Hello. Hello.
Which you get nerved upon. Now, when you have a family history, when you've had a previous history of anxiety or depression, and when you start having these symptoms again, irrespective of your profession, whether you're doctor, you're non-doctor, the disease or the disorder is not going to look at your profession. If the incidence is 1 in 4, it is going to hit you if you're a doctor. If your workload is too much and your elasticity goes away sooner, the symptoms will appear sooner. Hence, the very point you consult a psychiatrist. Definitely, a psychiatrist comes from a domain of medical science, and the symptoms are easier to grasp. I think that's the only thing that I'd like to add retaining to this topic.
Thank you, Dr. Jagjot. I think Dr. Moshmi also has a few questions for you. Dr. Moshmi, can you put on those questions, please?
Yes, sir. Sir, I have my question to Dr. Jagjot, sir. Sir, you were just highlighting the word breaks. So, what is your take on importance of taking breaks, like from the day-to-day normal routine, and how often should a resident be taking it to ensure that for maintaining the focus and productivity, it's adequate?
Right. So breaks are important for everyone, irrespective of their profession. Now, there are professions which require a lot of mental effort. That primarily involves the medical profession, since we're talking about doctors and ophthalmologists. When you require sustained attention, mental fatigue sets in first. Then you go for physical fatigue. Breaks should be individualistic. If you ask for a blanket statement, I'd say every fortnight, at least every fortnight. If you're a doctor and if you have a running practice, every 3 months, you should take a break for 3 to 4 days. If you don't, you would eventually have to take a break, and that will be an emergency leave. The body or the brain will not let you continue work. Your demeanor will change. You'll become a little more irritable to the patients. People surrounding you, as Dr. Ankita very clearly said, they'll notice it even before you notice it, that you are burnt out or you have reached the burnout situation. Talking to your senior is of the utmost importance. Your seniors will actually tell you that in our branch, I'll give you an example in psychiatry. So in our mental fatigue and emotional burnout is something that we suffer from. And I'll be very open about it. You cannot see it. So your muscles physically don't ache when you're mentally fatigued. But it's very difficult to think and take a medical decision when the next patient has come. So at that time, how do you know? It will not be visible readily. At that time, you have to know that, okay, my strength or my elastic strength is like I can see back to back, let's say 20 patients. And after that, I need a break. So what you do is, while you start practicing and the years pass, you understand your patterns, how your body works. Let's say I need minimum 9 hours or 10 hours of sleep, and I can't function properly without it. I have a friend, he's fine with 6 hours. So my break has to be of a 10-hour sleep. Or I take a 7-hour sleep at night and I divide my day into two halves. The first half, and then after lunch, I have to take a nap for 1 hour. And then I do another OPD till, let's say, 8 or 9. And in our set of the practice in many parts of India, there's a culture of night OPD. So we keep on working, working, working. You can't work incessantly. You have to divide your day into two parts. So yes, it is individualistic. Take a break after fortnight, do something completely unrelated to your work. Well, the prime example of, one of the, the strategies to take breaks is, I think sitting right in front of us, that's Dr. Ashish. If you see, he has a very good work ethic, at the same time, gym ethic as well. He works out. I thought when he clears, goes to AIM, goes to PGI, and after that he ventures into practice, he won't be able to sustain. He's still doing it. And I asked him, I had a conversation with him. He said, I worked till this, and then after that I hit the gym. And he's still doing it. Many of us are not able to do it. To have that ritual of doing something which is completely unrelated to work brings you back to work with a fresh mindset. Right?
Very well described, sir. Yeah. So
Yeah.
another question is, we know that residents are also involved in speaking in seminars or attending academic sessions where they have to speak up. So how to build confidence for public speaking, because people are stressed out about that fact as well.
Well, okay, public speaking is not really our domain, but I'll just add a few points. Basic principles of public speaking. First is you have to prepare. If you're well prepared with the key points, you'll be confident. Confident itself is nothing, it's just the absence of anxiety. The more prepared you are, the more confident you'll be. I can't make you confident, you can't make me confident. If I know my skill, I'll be confident. As simple as that. Once you prepare, you have to practice. Like our teachers or our seniors used to say, 5 बारी किया तो आता है, नहीं किया 5 बारी निकल जाओ. So you read it 5 times, you prepare it 5 times, you practice it 5 times. You will know the skill, you'll know the stuff, and you'll be prepared. Yes, there are certain individuals who have performance anxiety. For them, it is not about preparation. It is altogether a different ball game. They are very well prepared. In the practice, they will be the best. During the performance, just before the performance, they'll panic and run back. If that happens, it is not related to public speaking. It is related to anxiety or fear. We treat it and then they can go and, give the presentation. Second key factor is you have to know your audience. So if I have to give a talk, I need to know who the listeners are. Like today's talk was, about ophthalmologists majorly. Hence, you would see the presentation involved the minute details an ophthalmologist has to go through. I'm definitely sure it was chipped in, by the better half present there. So once you go into the details and you know your audience, your presentation becomes better. Lastly, there has to be a story in it, a personal touch. If you tell about someone who had that problem, who went through it, that's when the audience lit up. They want to listen to what happened to that person. There was an actual human being. It happened with me also. It happened to you also. I want to know your story. The moment you add the story to your speaking, people will wake up. Lastly, it is about the collective attention span of the audience, which is very small whenever we have a talk or a scientific talk. Because let's be honest, talks are, not the most interesting thing. Webinars or PowerPoint presentations are the most boring things that humans have ever invented. but still it's part of our life, part of our work, and we have to do it. In order to make the audience listen to you, you have to raise your tone in the middle, bring it down in the middle. You have to emphasize on certain words. Let's say the most important. I want you to remember resilience. So when I say resilience, I will speak it very slowly and I'll enunciate in a manner that hits you. And I'll say it 3 times or 4 times or maybe 5 times. You unknowingly will remember what resilience is. So audience बीच में चली जाएगी and then I would change my tone and try to bring them back. So these are the small points which can be used while you're doing public speaking.
Thank you so much, sir. Over to Sir Dr. Ashish.
Thank you, Dr. Jagjot. You answered all our queries very well. My next question is to Dr. Sonal ma'am. Ma'am is Associate Professor at SMS Medical College, so I think she'd be able to answer this very well. Now, what strategies would you recommend for residents to balance clinical duties, academics, and personal time? This is my first question. And second question, which we all have faced, the thesis stress. What tips you can give to the residents, how they can handle stress related to their thesis, about the thesis presentation, all the stats which they do. Obviously, all of us are very new. The residents are very new when they start doing their thesis. So that is one of the most stressful time when they have to do their thesis, they have to do the presentation. How can a resident handle thesis related stress?
Thank you so much, Dr. Ashish, for this well-orchestrated webinar with very pertinent questions. And again, this is also a very important question. I think the other speakers can also chip in later, but I'll just emphasize on a few points here. The very first point that I want to emphasize upon is regarding the time balance, regarding your question on academics, personal time, and all this. For me, I think one important thing was this terminology, knowing thyself. As Dr. Jagjot also pointed out, that everybody has a different threshold and different type of, a way in which they handle stress, the way in which they are able to take care of things. So for me, one of the things that was very helpful was I won't call it journaling exactly, but maintaining a small notebook of sorts during my PG, and whatever the seniors used to tell me, not just the works, but suppose they are teaching me something, they're holding, this is how you hold the tonometer, this is how you do this. So those small points also, even if they are given in the books, I used to write them down as they are telling me in the way they tell me, and I would try to revise it before I do that thing the next time. That was very helpful, particularly in the OT, because in the OT we are absorbing a lot of information, knowingly and unknowingly both. We are learning through seeing, through hearing, through what we are feeling also, and all those senses, once we've moved out of the OT, a lot of emotional excitement and sometimes sadness also overwhelms us. So we may end up forgetting the minutiae, the details. So for me, journaling after the OT, not the feelings, but the lessons over there was very helpful. So I maintained a separate OT notebook with me right from the first year of residency till my final year. And I even used to keep adding points during SRship and later also. It has been a very useful notebook for me. And more importantly, for the OT learning and the practical aspects, what we need to also remember is that we should write our injuries in sand and kindnesses in marble. What I mean by that is, it's very often that one small mistake and somebody is critical towards us, and we'll remember that for the whole week and tell everybody, "Mujhe to sab dant dete hain, I am this person," and then we'll go on and on in that negativity cycle. The 20 things that we did right, we will forget those. The surgery that went well, one step that did not go well, we'll dwell upon it, we'll think about it, and the next time we'll not even remember the steps that we unknowingly did well, and we end up making a mistake in those steps. So I think writing your injuries in sand and remembering the lesson from the criticism and then moving forward is very important. This is about the OT and the practical learning. Then coming on to the academics part. So for me, again, discussing with my seniors and juniors was very helpful. Whenever we had a presentation that was told to us, like, next week you have to present on this seminar or something, I used to request my first years when I was a second year, and then when subsequently I was a third year, then both the first year and second years had to sit and listen to my presentation before the actual day of the presentation, so that when they would ask me doubts, then I would understand what I don't know about the topic before I'm actually going and presenting. So, and discussion with the other units. So when I have seen something in oculoplasty, they have seen something in retina, and we would all end up discussing over, yes, lots of pasta and cheese. So so that was a sort of break, as well as a way to read and revise what we have learned and what our takeaway points are. And one important thing regarding academics was one should not go on re-revising the easy topics and the things that we are familiar with. Sometimes, you are working in retina unit, you'll read up in depth about those things, and you leave out glaucoma because it's a different posting, or you're not interested in it. And then in exams for the MS candidate, at least, or MD candidate, it's everything is going to be of equal marks. It's not that one part will be more important than the other. Yes, your thesis topic will be taking you a little further, but still you have to know everything. So do not re-revise the easy topics, tackle the important difficult topics also. And giving time to your personal life is important. Read daily. I mean, I remember I still find that when I'm doing some mundane note taking, if I have an ophthalmic podcast, I'm doing a household chore also. If I want to listen to some topic, I'll put on that podcast and I'll listen to it while I'm doing that work. So I think all that is really, really helpful for me. Now coming on to the question regarding the thesis. So in life, as in chess, forethought wins. So being well prepared will be very helpful from the very beginning. If suppose your topic and that part is to be dealt with the guide, I think that's something that we really cannot cover in this particular webinar. But once the topic and all is allotted, then if you will keep your master chart headings handy before you start collecting data, then you'll not miss out on anything. Keep few hours every week for seeing what all has been the progress. Keep alerts on each and every website, so that what is the latest in your topic that has come, and you can keep adding it to your review of literature from the very beginning. Don't just think that, okay, when the last date will be announced, just before that we'll start writing. So the stats and all will begin with when you are meticulously taking down the patient data. So I think again, regularity. And for me, if somebody tells me to complete everything in 1 month's time, I would be overwhelmed. And some people think that, okay, why take stress daily, we will handle it in the end. So everybody has a different approach. My approach has always been slow and steady wins the race. So I would always break the things and keep doing a little bit off and on every week, some hours to the topic and reading it. So similarly, I would give similar kind of advice. So you really can't give advice which is different from what you have done. So that's all that I have to say. And so many other professionals are there. They can add much more, I think.
Dr. Ankita, if you want to add something related to the thesis stress the residents face, how can they basically handle that stress in a better way?
As Dr. Sonal rightly mentioned, what happens once the topics are allotted, right? Usually, it used to happen with us also. We were like, okay, we still have time. We'll do it आराम से. अभी तो पहले बाकी जो हमारे अभी निकले हैं उनका एग्जाम होना है, सब चीज उनको पहले tackle करने दो. Later on, it will come to us. So we notice that as and when you keep on going ahead, it builds up the stress, and then you tend to deal with it in a very humongous manner towards the end. And that further adds on to a lot of misery there. So yes, slow and steady wins the race in this case, because you are dealing with thesis, you are not dealing with an extempore, you're not dealing with a debate, you're not dealing with something which is just a random thing here. So you have to collect the data, you have to be very consistent here, because if you are missing out on anything towards the end, it is going to lead to a lot of stress to you, unnecessary stress to you. Because at the end, you have to understand it's not just the thesis there. You have to prepare for your exams also. You have to do other case presentations and everything. A lot of things are going to combine at that point of time. So again, few people work better under stress because they take it as there's a concept of stress here. One is eustress, another one is distress. So eustress is a good stress. Okay, there are few people who channelize their energy. They feel more driven once they take stress as a driving force. So they perform better. But if that stress piles up and it leads to a stage where it becomes too much to handle, then it can definitely lead to distress, and then you will come crashing down. So here, especially with case of thesis and something which is that of an importance, then definitely slow and steady necessary in this case.
So I think this is a take-home message for the residents that they should go slow and steady for their thesis. Otherwise, their thesis-related stress can turn into a burnout. And finally, my last question will be to Dr. Devanshu, sir. Sir, so how can our young ophthalmologist approach you? What all will be done at Thriving Minds? And basically, if they want to contact you, how can they do that?
Yeah. So I think we had a wonderful discussion, and the most important thing is the initiative which you have taken. We have started this conversation, and the great thing is to start a conversation around mental health, around the issues which we as ophthalmologists are facing, and that is great, and that is where Thriving Minds also comes into picture, and we are trying to give our inputs and help and collaborate further. So that is there, and I think I would encourage everyone to take away these points, but not only take away these points, but to basically encourage themselves as well as others who they feel are facing burnout or facing other kind of mental health issues or any struggle, to actually seek care. Seek care. We, as Dr. Ankita mentioned, that as doctors we advise a lot of things to patients, but we are the last people to seek care in any aspect. So mental health is also equally important, and it's I would encourage everyone to encourage an environment for themselves and their colleagues to actively seek care and make it a like a not a stigma but a normal thing to take benefits whenever is required. So if you find anyone who is struggling, or if you find yourself struggling, feel free to reach out to us at our team at Thriving Minds. We have a wonderful team of psychiatrists as well as clinical psychologists in our team, and we are providing all the services online as well. So you can visit our website. You can take a screenshot of the slide which is there. So you can reach out to, you can visit our website, know more about us, and as well as note down the first number, which is the WhatsApp number, where we also have an automated chat system. So you can basically interact and you can ask your doubts as well, even if you are not feeling any having any mental health issues. But if you want to ask or know about certain mental health issues, you can do that via our website through the chat system or through the first number which is mentioned over here, which is the WhatsApp automated chat system, and you will be able to get a lot of insights, as well as if you wish to seek care, you can do that.
Yeah, thank you, Dr. Devanshu. We'll also try to put up on our Yosi portal so that all the Yosi members, they can directly reach to your website, and then they can seek the help, or the automated chat. They can directly chat on there, and then they can basically seek the professional help if that is required. So
I'm
I think that,
in
yeah.
the link in the chat here also for the people who are here in the meeting. They can directly use this link to reach out to our chat system or to or connect with us, right?
Also, this is basically the WhatsApp AI mediated chatbot.
Right.
Okay, the one which we discussed earlier. So anybody who wants to have some his or her doubts clear can directly go on to this WhatsApp chatbot and then can start the discussion. And eventually the chatbot would direct you and would tell you whether you need a professional help or not. Is it so, Dr. Devanshu?
Yeah,
This is
right.
how it will work, right?
Definitely, that will also be there, and also it will help you if you want to decide whether if you want to know whether you should consult a psychiatrist or take therapy session from a psychologist. That kind of questionnaire is there. You can answer those questions, and it will guide you further.
Okay, thank you, Dr. Devanshu. Thank you.
So before we end the session, we'll just take a photo with all of us. So ma'am, Dr. Ankita ma'am, can I request you to stop sharing your screen, please?
So before we end, I would ask Dr. Sonal to just give some concluding statement on how our webinar was, because this was the first time we have organized this webinar, one of its kind, by Yosi. Uh, and that would actually help us organize it in a better way in the coming sessions.
It was a great effort, Dr. Ashish, and I'm really thankful to the team Thriving Minds, Dr. Devanshu sir and Dr. Priyanka ma'am for giving your valuable time to us for this excellent initiative, as well as for directing it, making the presentation really directed to young ophthalmologists and dealing with their problems. It was not like somebody's giving a mundane talk about psychiatric problems, but it was very, very, focused on whether cataract surgery has caused a problem and that way. So really thankful to you, ma'am, for that. Dr. Jagjot sir, your comments and the way you handled all the questions directed by Ashish were wonderful. They were answered so meticulously, and like it was a holistic answer, I should say, and everybody who was listening to you would be benefited by these talks. So great job, Mosmi and Ashish, both of you. I'm really thankful to be a part of this webinar, and I'll pass on the Thriving Minds details to my residents also if they ever need it. I hope they don't, but if they need it, they should be in access to such a thing. What are the waiting times on these, sir? I mean, like I've heard that psychologists are available. I don't know about Thriving Minds, but in general, like there's a lot of waiting time to these services.
So actually, we have tried to incorporate this part also, and especially I had a word with Ashish last time, so he also had these concerns. So we are having slots which are more suitable for young ophthalmologists, like in the evening time, more slots are available, and waiting time depends on which therapist, obviously, which therapist you want to have a consultation with, and they're not much. Like within the next 2-3 days, you will be able to. Or maybe on the same day also, in most cases, you will be able to get an appointment.
Okay. Thank you, sir.
Thank you.
So before we end the session, we can take a group photo for the webinar. So all of us with a customary Yosi sign, and so that Moshmi, can you please click the
Yes, sir, I'm doing.
Everybody who is available can please switch on their video mode on if possible. So we have roughly 14 participants right now.
Yeah, it's being taken.
Okay. Thank you everybody. Thank you, Dr. Jagjot. Thank you, Dr. Ankita, Dr. Devanshu, Dr. Sonal. So this was our first webinar. Hopefully we'll have it in a couple of months again, the second session of Yosi Yen webinar. In between, we'll also have some meditation sessions, online sessions, or some yoga physical sessions, which we are planning further. Let's see how the new year 2025 basically will make it on a bigger scale, and more people will join. People have shown interest to join Yosi Yen committee. So we'll work in different parts of the country, and we'll see how things can go about it.
Thank you so much. Thank you for the opportunity.
Thank
you, everyone.
Thank you, and all the best.
Bye. Good luck.
Okay. Thank you so much.
See you.